There's definitely a strong association between endometriosis and infertility, in that if you look at the infertile population, the prevalence of endometriosis is significantly higher than in the fertile population.
Endometriosis can cause infertility in a number of ways. First of all, there's a structural component. The endometriosis distorts whether it's the fallopian tubes or the normal pelvic anatomy. And secondarily, there's an inflammatory component. So endometriosis causes so much inflammation that it makes it difficult for either the egg to get to the tube or the sperm to get to the egg. Or if they actually do meet, there's so much inflammation that the egg and the sperm don't implant properly.
This reaction produces a lot of cells and chemicals and cytokines and other chemicals in the pelvis that make it an unhealthy place for the sperm and egg to work the way they should.
Excuse me, it's just, I get emotional, but it's really bad, especially when you want to have children and you can't have kids. And endo robs you of wanting to have a child.
That's hard to hear at 13, considering you're still a kid and you always have dreams of having kids and getting married and having the white picket fence and happily ever after.
In my group of patients that I'm working with, I frankly encourage all of them to get their endo excised before they enter fertility treatments. The reason for that is I've seen many spontaneous pregnancies occur once the disease is done. They don't even need the infertility work.
There's lots of things that guide patients' decisions as far as what's the optimal fertility treatment. And it's not always just the treatment that's going to give us the best chance of success, because emotionally, there's a lot of considerations to make. Fertility treatment takes a lot of time. Cost plays a role. So everyone's coming from a different perspective.
Even after surgery, you still have the disease, and you got to know the disease well. You got to know your own enemy in order to manage it.
The non-surgical part of endometriosis really is dealing with restoring health. The surgical part can remove disease, but lack of disease does not equate health. And again, this is an area where Western medicine just comes short.
Patients need physical therapy after quality surgery for endometriosis because even though the disease has been cut away, all the other surrounding pain generators are still there. And so if your pelvic floor has been spasmed for, say, 6 to 10 years because of diagnostic delay, it's still going to be in spasm even after we remove the disease.
By getting rid of the trigger points, by calming down the nerves, that is what calms down the pain. It calms down the pain pathways. If a nerve is restricted, or muscles or tissues are restricted, or even an organ's restricted, it can send messages to the brain that there's pain. So what the physical therapy does is it helps release the tension in the muscle, the restrictions. It helps the nerves glide better. So that in itself can help decrease pain.
Women that I see with endo, with chronic fatigue, fibromyalgia, irritable bowel, all of these things, they all have the same fundamental issue, which is inflammation.
It's an inflammatory disease. If you look at it from that perspective, it's inflammation, and it's awful.
So addressing the inflammation is really important, and how we address that inflammation is variable. There's nutritional approaches, there's herbal approaches, there's exercise, there's mind-body aspects of just calming the mind down.
It's multifactorial, so you just can't do one and expect things to work. And in fact, you might try one and nothing happens, but it's happening inside your body, you just can't recognize it.
In terms of treating endometriosis with Chinese medicine, it is definitely okay and often recommended to combine it with Western medical treatment. And the nice thing is that Western medicine and Chinese medicine are coming at the problem from such different angles, they actually complement each other really well.
The goal is the same. We're trying to get the body back to health and optimum functioning. And the body's capable of doing that. And what we're doing is we're basically supporting this restoration process. We're not doing it for the body. We're supporting the natural, healthy normalization process.
The goal is whatever will return a woman to function. You have to figure out what the trigger is for your endometriosis. People ask me, can I still do sports? Can I not do sports? I've had patients with endometriosis teens who have been Olympic athletes. I have others who find that their pain gets worse with physical activities. I don't think we can generalize, but I think we all need to find out what works. Is it heat? Is it relaxation? Is it acupuncture? Is it just taking an hour and smelling something that's pleasant and having a massage? Everybody responds differently. The goal is to make you functional.
Let's start with sleep. Sleep is often just forgotten, and it's really number one, because if you're not getting sleep, you're not going to feel well. Number two, actually, is cleaning up the digestive system. You're not going to be able to absorb nutrients unless your intestine is working.
Basically, our immune system starts in our gut. In order for the immune system to be healthy, the digestion needs to be healthy. We have a symbiotic relationship with the flora in our gut. We cannot live without the bacteria that lives in our gut and helps us digest our food. Most, I would say 80 or 90% of my patients with endometriosis, if not all, have food sensitivities.
We're not talking about the kind of allergies you get with shrimp or seafood where you eat it and all of a sudden your lips swell up. We're talking about mostly chronic fatigue, achiness, the sorts of things that often go along with endometriosis. The food allergies form because food particles can get through the intestine and come in contact with the immune system, which it normally does not do. And so it causes more inflammation when you have food allergies. If we can take away the foods that are responsible for the allergies, then we can start working on decreasing the inflammation, because that's essentially what we're trying to do.
So one of the ways we treat endometriosis is to calm the immune system down. And we do that through diet. That's one of the big ways we do it.
Things like coffee, sugar, red meat, dairy products.
Sweets, dessert, candy, muffins, cookies, juice. It's perfectly fine to have 1 or 2 pieces of fruit a day, but if you have more sugar than that in your diet, it's probably too much. Sugar is like an inflammatory agent. If you don't believe me, you can try it for yourself. You can binge on sugar for 3 days. Whatever little aches and pains you have, whatever little problems you have will invariably feel worse. If you get off sugar, the inflammatory process slows down in the body. The modern processed American diet is furthering that inflammation and accelerating the disease process. Processed food is so ubiquitous in our culture that I actually have to explain to people what I mean by that. And I mean things that are pre-made and packaged and canned that come out of packages and cans. If you have to use a can opener to open it, it's processed. So you buy canned tuna and you think all you're getting is a can of tuna, but they actually use milk protein to stabilize it. And it's not on the label, at least not in the United States. So you never really know what's in the food you're eating if it's processed.
What we worry about is for example, the corn in our diet. So corn oil and corn syrup, if you read the ingredients, is in everything. And if you track the increase in these sort of inflammation-related diseases, obesity, etc., it almost tracks with the point where we started doing that.
When you look at the diets that so many people have, it's a wonder that they're even standing up. You cannot keep feeding your body junk and expect that it can prevent disease or heal you once you are sick. There is one caveat on diet and endometriosis. There's no one endometriosis diet. So what may work for one person might not make any difference for another person.
I've tried pretty much every diet in the book, trying to treat myself. I've tried paleo, I've been vegan, I've been vegetarian, I've cut out soy. I've pretty much eliminated every typical allergen that there is. Even after surgery, I was experiencing some difficulty with digestion, and I finally consulted with a nutritionist and came up with a plan that was right for me, and that's made a huge difference. There are some supplements that kind of rise to the top for me that come up very often. One of them would be fish oil, is something that is so important.
It's not a panacea. If you're eating a lot of fast food and a lot of fried food, you can't go home at night and take fish oil and think, oh, everything's going to be fine. It's really a lifestyle.
A pill is not going to solve everything. You have to exercise, you have to do the best that you can to maintain a healthy lifestyle, because you're just going to feel better.
It's interesting that if you look at certain graphs, like the chemicals in our environment, autism, asthma, endometriosis, it all parallels our use of chemicals.
I'm coming from Taiwan, and I remember in the early 1970s, one day one of my attendings was doing surgery and found out the patient had severe endometriosis. He stopped the surgery and called all the OB/GYN staff in the hospital, come to the operating room to look at it. What is it, severe endometriosis? Because we simply did not see many severe endometriosis, which is very rare at the time. But if you look at if you go back to Taiwan now, we have tons of endometriosis. Almost every day, every hospital have it.
So in 1992, I tracked down a colony of rhesus monkeys where 2 monkeys had died, and they discovered that the animals had died from endometriosis. I brought in top experts to do laparoscopies, and at the end of the day, they broke the code. 79% of the animals exposed to dioxin had developed the disease, and they developed it in a dose-dependent relationship. The more dioxin, the more severe the disease.
As a theme, endometriosis is considered to be estrogen-driven. So we know there are receptor sites for estrogen on the endometrial growths. There are environmental toxins that act like estrogens. They're considered xenoestrogens. They are considered to be very strong estrogens. Actually, they bind to receptor sites and have an influence thousands of times greater than what our own natural estrogen has on our body and on our tissue.
So when these hormone disruptors get into the body, they mimic our own hormones. And every cell in our body have receptor sites. So you think of that as like a keyhole into a door. And the endocrine disruptors or hormone disruptors, they basically make their way into these receptor sites and take up space. They can magnify our own hormone function, they can block our own hormone function, and they can just alter the way our hormones function altogether. So think of it like as your own hormones. If they they were to take up space on your cells and they were to unlock that door, they're sending messages into the body on, what to do, how to protect the body, what is the function of the body, whether it's thyroid, testosterone, estrogen, any hormone. But if we take in a chemical that mimics estrogen, say for example, and then it blocks it, it's like putting a key into a rusty keyhole and the door never opens. From the moment a person wakes up, we are exposed to these hormone disruptors. I'll just give you an example. You get up in the morning, the first thing you do is brush your teeth, and most people's toothpaste has fluoride in it. And many of them are flavored with aspartame and other artificial sweeteners. Then you jump into the shower, and your soap probably has fragrance. And the word fragrance can entail or could include hundreds of different chemicals that we don't even know because they don't have to tell us what those are made up of. And then you use your shampoo, you use your conditioner, we've got parabens, and we know that the parabens mimic our estrogen. So there you are in the shower, your pores are wide open, you're just absorbing all of those chemicals that are known to disrupt your hormones. Then you get out of your shower, you towel off with probably a towel that you washed in a washing machine with fragrance in the soap, and if you've dried it in the dryer with those fabric softener sheets, those are filled with chemicals. And then you're dried off, what do? You lather up with some more lotion, and you've got more parabens, more fragrance. And then your makeup and your fingernail polishes. I mean, it can go on, and you haven't even left the house yet.
The idea is, how can you decrease your chemical burden? I mean, we can't change our environment, certainly not overnight.
You can change what you're exposed to in your own home. And just by knowing that where you spend most of your time is very clean, then your body's stronger for when you are assaulted with those external chemicals when you go out into the world.
You can avoid chemicals by not necessarily eating everything organic, but there's certain fruits that, in particular, that have a very, very high level of herbicides and pesticides. And if you go organic for those fruits and vegetables only, then right there you're decreasing your level of toxins. So we can't remove everything, but we can decrease our body burden. And that's real important.
There is no way in today's world where we can rely on anyone to take care of us. There's just too much politics, too much money involved. We have to take charge of our own health. You can shop locally, you can talk to your farmers, you can grow your own food, you can seek out holistic practitioners who will help guide you into the resources you need to protect you from this. Now, the Environmental Working Group has a website where you can go in, and it's called Skin Deep, where you can search it by cosmetic database, and you can put in your body care products, whatever lotion or shampoo you have, and they rate it from 0 to 10, and whether it's a low hazard, moderate hazard, or high hazard. So then you can start cleaning up your body care products, and it can be very daunting for people. So I always caution my clients to not get overwhelmed and give up, but think about what's the first line of defense. What are you exposed to in the morning when your pores are open in the shower? Your shampoo, your conditioner, your body soap, your body lotion. Start with those first 4 things. And then if you've got highly toxic body care products, dump them and just get some clean ones. And they offer, at the top of their website, they have a huge list of clean products. So if you don't know where to start to go replace your products, it's right there at your fingertips.
It's not really rocket science. I think it's something people could take, care of themselves and control over their own health. I think this is the answer to me for the toxicant world is avoid learn where the toxins are coming from, avoid those, change your diet, and you'll do yourself a world of good.
When you are diagnosed with endometriosis, or if you think you have endometriosis, you simply must do your homework. This is not a disease where you can throw yourself at the feet of a doctor and say, "Cure me." Only you know your body. The disease is highly individual, so what might have worked for your friend may very well be the worst thing for you. You have to understand that with this disease, there are not clinicians who will lay out a whole smorgasbord of options. When you choose your physician, you are likely choosing your treatment. If you choose a physician who is a surgeon, you are very likely to end up with surgery. If you choose a physician who likes, the drugs that are out there, you are very likely to end up on those.
Doctors don't have all the answers. I will admit that. I admit that to my patients. Like, I can't know everything. I can't know all the answers. And I certainly don't know what it's like to live your life every single day also. No one is going to know your body inside and out as much as you do. Ultimately, the highest level of wisdom comes from inside your body. You are the expert.
Be persistent. Educate yourself as much as you can about the disease. I had myself 5 surgeries that were ineffective with a surgeon who wasn't treating the disease properly before I got to the right surgeon. But once I got to the right surgeon, my disease was managed much, much better.
So many doctors just want to calm the symptoms down and not treat the problem. And even though there are only a few of them, there are excision specialists who can help you and can get you pain-free. I had surgery 4 days ago, and I feel better than I have in years because I found the right doctor.
It does get better. You will get to a point in your life where you'll feel you have learned something from the experience, and you are learning something. You're getting tough. You're getting really tough so that you'll be able to deal with other things that come down the pike.
I don't think that women give themselves enough credit in knowing that they are in charge of their own physique, they know their own body, and they know it well, and nobody can tell them different. I think that we have a tendency as women really to subvert our pain and put everybody else ahead of us. Fight it like it was for someone else's battle. Fight it like it was your kid's battle. Fight it like it was your parents' battle. Fight it like it was your best friend's battle. Because if you're not well, you can't be good to anybody around you.
Speaking up about the disease matters. Diseases that get a lot of attention, a lot of publicity, where Congress knows about them, tend to get more funding, more help, faster relief.
Endometriosis puts a burden on society of an estimated $119 billion annually in associated lost productivity, associated care, hospitalization costs. So this isn't just a disease of women with painful periods, this is a societal disease.
There are a lot of women who don't see a way out, and they just, live with tremendous sadness and discouragement, and that's really unnecessary. Women need to be empowered, and they need to be empowered with knowledge and information, and know that you don't have to live with it. There are more that you can do than just accept what the doctor says. Live with it. Just live with it. And I like to tell those doctors, how about you live with it?
Until the group that is affected stands up and says, enough already, it will not stop.
Give yourself a break. Appreciate that really the vast majority of the time, you're right, you're just in a bad situation.
Don't accept what 1 or 2 or 10 doctors tell you is normal when you know that something is wrong.
Do as much as you can to learn about your symptoms, learn about possible treatments.
Get second opinions or third opinions or fourth opinions.
Keep pushing until you find the right provider. They are out there. Find a place that understands you and will listen to you and where you feel supported.
Listen to yourself, fight for what you need to get, and there is hope. There is life after endometriosis. It is possible.